Welcome to our conversations about brain health, hosted by the Neurological Alliance of Ireland as part of our programme for World Brain Day 2022. I'm delighted to be joined by Professor Brian Lawlor, Connolly Norman Professor of Old Age Psychiatry in Trinity College, Dublin, and Deputy Executive Director of the Global Brain Health Alliance. Professor Lawlor, thank you for joining us today. The theme of World Brain Day this year is Brain Health for All. Can you comment, please, on the challenges and opportunities involved in addressing brain health here in Ireland?
Thanks, Mags. It's a great pleasure to be here. Let me just first start by saying what I think brain health is all about. And brain health is not simply the absence of brain diseases. Brain health is really about getting the most out of your brain and protecting your brain across the life course so that it's more resistant to wear and tear and the buildup of pathology as we get older. So I often think of brain health like a pension. You invest early and frequently, and then you reap the benefits later in life. So you asked about opportunities and challenges. So here's the opportunity. I think we can grow our brain health pension and potentially reduce the risk of getting dementia by tackling modifiable risk factors across the life course. These modifiable risk factors include low levels of education, smoking, high blood pressure, diabetes, social isolation, loneliness, heavy alcohol consumption, depression, traumatic brain injury, and age-related hearing loss. So that's the opportunity we have for brain health and for dementia prevention. However, there are some major challenges out there, and I think the biggest challenge is around equity. Inequities, as they exist in our society at the moment, are the perfect storm for poor brain health outcomes. So those individuals that could benefit the most from tackling the modifiable risk factors that I spoke about can often be left behind. So these are people that experience poverty, ethnic minorities, those with low levels of education, and people who have less access to healthcare. So they don't benefit in terms of their brain health unless these inequities are tackled at a societal level. And I think in Ireland, a very good example is the traveller communities. This community have poor brain health outcomes due to poor access to healthcare, and they have a higher proportion of risk factors for poor brain health, such as lower educational levels and mental health issues. So dealing with inequity is a major challenge for all of us, and here in Ireland as well. And if we're serious about tackling dementia prevention by reducing modifiable risk factors at a public health level, we need to address inequity across our society so that people that can most benefit from a brain health approach really get a proper opportunity.
Thank you for that, Professor Lawlor, and I love your pension analogy. I think that's a really good way of getting it across, and certainly that message around equitable access. I might move on to another question now. Do you think there's a need for a more integrated approach to brain health in Ireland, of more specialties, for example, or areas of the health services working together a bit more?
Very much so. And at the Global Brain Health Institute here at Trinity College Dublin and University of California, San Francisco, we believe very strongly in interprofessional and transdisciplinary approaches to brain health. And our program here at GBHI aims to train future world leaders in brain health and dementia prevention from many, many different disciplines. So we train people from the arts, from humanities, from engineering, architecture, the social and biomedical sciences, including physicians like neurologists and psychiatrists. And it's only by breaking down these professional barriers that we believe you can change the narrative around dementia and brain health. So let me just give you a concrete example. Social prescribing and a joined-up approach to arts and creativity, where doctors and artists and creatives are working hand in hand, can really have great benefits in terms of improving mood and well-being in people at risk of poor brain health. And I'm thinking particularly of those with mild cognitive impairment and people living with dementia.
And we would have seen the Creative Brain Week were partners with us for Brain Awareness Week this year, and we were delighted with that initiative. It was so different and so groundbreaking, as you say, bringing those collaborations together. And certainly we're looking forward to seeing that, in future years as well.
Yeah, well, we're planning for 2023 and 2024 right now for 2023. So we're looking forward to working with you again on that. It was a fantastic week, and it has reverberations, around Dublin, around Ireland, around the world. And we hope that will continue, not just during the week, but also during the years.
Exactly. And I suppose it gave people a sense of what could be done in terms of pushing the boundaries of who collaborates with who. And that brain health, in that theme of World Brain Day, that brain health really is a message for everyone.
Yeah, no, brain health is for all. And I guess, as we talked about earlier, we have to deal with inequities to make sure that people are not left behind. And I guess, and the people who can most benefit are often left behind here. So that's really going to be, it's a major focus for GBHI. And I think for World Brain Day and also Creative Brain Week, I think it's dealing with these inequities. That's really what we have to focus.
And I think you raise a really important point about the challenge for awareness campaigns, that sometimes awareness campaigns only speak to people who are receptive to those messages anyway. And the challenge really is getting, as you say, to those marginalized groups, to encourage them to be able to take on board health messages.
Very much so. And I think they have the most to benefit really in terms of their brain health. And oftentimes we're serving the served. We really have to think of the underserved, the vulnerable, those, as you said, who are marginalized. And again, there's great benefits can be reaped by reaching these individuals, but we have to work harder at reaching these marginalized, vulnerable groups.
And I suppose, Professor Lawlor, it's a little bit about building on some of the health messages that people have in their minds anyway. So as you said, what's good for your heart is good for your brain. Do you think that there's a potential there to build on some of that health messaging already, rather than kind of introducing a new paradigm to people?
Yeah, no, I think we can build on heart health. I mean, I would see brain health as a new heart health. And I guess if we were talking 30, 40 years ago and saying that, look, if we raise awareness and take a public health approach to heart health, we'd be able to decrease the risk of stroke and heart attack over the next 30 years. People would have laughed at us. But we're saying the same thing now about brain health. I mean, it really is the potential to reduce the risk of people developing dementia over the next 20, 30 years if we take this public health approach. But it has to be for all. It has to be across the life course. And we do have to reach those vulnerable and marginalized groups, particularly early in life. Childhood education is crucial to building up cognitive reserve and protecting your brain throughout life and for later in life. So you really have to get in early, particularly with these vulnerable at-risk groups.
Absolutely. And I think you've answered some of my final question in terms of what you feel has worked well, just in specific areas of brain disease, maybe as an example, and what could be replicated across other brain conditions. Because we've seen I suppose, in terms of Alzheimer's disease, we've seen those preventative messages being quite strong, and through the Understand Together campaign. Do you think that across other brain conditions, you can replicate that similar, positive preventative aspects?
I really do. And in terms of what has worked well, I mean, as we said already, brain health is for everyone. And by that, I mean, brain health is for everyone, even if you have dementia. And I believe that what's worked well is taking a brain health approach for people living with dementia, addressing risk factors for them in a proactive way, particularly as part of post-diagnostic intervention, and actively managing medical comorbidities. This has worked well for these individuals. It's very important in terms of their well-being and their outcomes. So, for example, in people living with dementia, taking a brain health approach includes minimizing drugs with anticholinergic side effects that can impair their cognition, reducing the numbers of medication that they're taking, being vigilant about the development of delirium and infection, addressing high blood pressure or diabetes in people living with dementia, asking people with dementia, if they're drinking too much, to cut back on this, increasing their exercise levels, getting people with dementia to take part in creative and cognitively stimulating activities. All of these, I believe, have the potential to stabilize the course of the person's illness, and is taking a brain health approach. And as I say, people with dementia can have good brain health. And in terms of what other areas could this be rolled out to, I think this proactive and health promoting brain health approach, as I call it, could and should be extended to people with other medical or neurological conditions. So I would include people who have heart failure, people who have respiratory disease like COPD, people with multiple sclerosis, Parkinson's disease, as these are brain health at risk groups. And they could really benefit from all of the things we've talked about, this type of proactive, preventive, and brain health approach.
Yes, so healthy living isn't just for the well. You're saying, you know, that healthy living, again, those healthy living, those brain health messages are for everyone.
Yeah, that's the concept of brain health. I mean, it's for everyone. It's achievable. It is something that we should try to aspire to. It's like physical fitness. It's a health promoting value. It's a value that we should look towards and to try and achieve. And you can have brain health even in the presence of brain disease. I think that's a really important message.
Absolutely. Professor Lawlor, thank you so much for your insights today for World Brain Day, and it was a pleasure speaking to you. Thank you.
Thank you, Max.